I've talked for about 7 months now on healthcare in this country. It's finally heating up on the national scene, and the current proposals under discussion bomb, I hope. It's just like all that other legislative reform that we've heard about. McCain-Feingold, Sarbanes-Oxley, the Consumer Product Improvement Act of 2008, where legislators have the intention of improving a situation and they just turn it into a complete disaster. There are two areas I'd like to see addressed in healthcare in this country. First is I'd like to see us all work on reducing the costs and improving the fairness for people who get their insurance in the individual market. That means expanded HSAs, improved pooling mechanisms, tax treatment changes, drug reimportation, and tort reform if I forgot to mention it. But for all of us, whether we get our insurance from the government or our employer, we could still benefit from a change in mindset. It's critical to remember that the biggest chunk of increases in healthcare costs come from improvements in medical treatment. So unless you want to be treated by leeches the next time you get sick, I suggest that you prepare yourself to spend more of your disposable income on healthcare. If, God forbid, if something really bad should happen, like an accident or a terrible disease, you would be grateful to pay at least for excellent care. But what about the day-to-day stuff, the mundane stuff, the birth control pills, the heartburn medication? Should we really be expecting our insurance providers to cover these things? I have car insurance, and I would never expect my insurance provider to pay for a tire rotation. So maybe I shouldn't expect my healthcare provider or my healthcare insurance provider to pay for antibiotics for a run-of-the-mill infection or a cold. When we can't see those costs, they creep up. And I think we need to start seeing those costs. So it's like somebody's always paying for dinner and we're always ordering the lobster. If we could see those costs, and if the healthcare profession stopped hiding them, we could actually put downward pressure on them by transparency and competition. I'm not saying this is going to work for emergency open heart surgery, but I do think that the money we save on the little stuff could help us with the big stuff. And that's the end of my discussion on healthcare. I'm done with it. My next topic will probably be that TARP crap and why I hate it so much.